Welcome to Learn and Go with Laurie. I'm Laurie McCauley from Optimum Pet Vitality, and today I'm doing a spotlight on laser used with 980 nanometer wavelength. So this is studies looking at just 980. There's not a lot of them. I spent quite a few hours looking, and this is what I came up with. The first study is looking at humans that had orthodontics, so always uncomfortable, where they took 200 grams per centimeter squared per side, and they put pressure on it. Normally a very uncomfortable thing. And then they gave one dose of 600 joules of laser therapy, just 980, and looked at pain scale at different times. And what they found was at 24 hours, significant difference. So visual analog scale went from 2.5 in the control to 1.2. Fortunately, in the other times, there was a decrease in pain, but not statistically significant. So that's study one. The next study that we're looking at is looking at people with chronic lower back pain, and this actually happens in a lot of us. They took 100 people that had chronic back pain that had been resistant to other treatments, and they treated them 3 times a week for 3 weeks with either exercises or exercises and laser. The ones who didn't have laser had a sham, so it was a nice control. And then they looked at the visual analog scale again, and what they found was that the patients that had exercises plus sham laser, their VAS dropped by about 2.25% or 2.25 points. The patients that had exercises and the 980 nanometer laser actually dropped by about 4 points. That's significant. So if you have lower back pain, it gives you an idea. And then you can say, okay, well, how much did they give? They actually gave 37.5 joules per centimeter squared. So that's quite a high dose over about a 2.5-inch diameter area. So when we think about our dose, we want to know that we can go higher than what we may think of with other wavelengths and realize it may take that to have significant pain control. But we can get it, which is a really good thing. The next study looked at iguanas. So they took iguanas and they did 3 wounds on each of them, and then they treated them with either silver sulfadiazine, control, nothing, 5 joules per centimeter squared, or 10 joules per centimeter squared. And what they found here, well, why you need to read the whole research article, the title was 980 nanometers was significantly better than the silver sulfadiazine. But what they didn't say until you read the rest of the article was that the control, 5 joules per centimeter squared and 10 joules per centimeter squared, were exactly the same. It was really that the silver sulfadiazine made it worse. So read the whole article. The next one was actually a really good study looking at nerve regeneration. They took multiple variables. So they started with 980 and 810, and then they said, okay, which one do we want to use? 980. Then they looked at different amounts of energy, so anywhere from 2 to 200 millijoules per centimeter squared. So that's up to 0.2 joules per centimeter squared at the nerve in a petri dish. And they said, okay, well, what's the best amount of energy? Then they said, okay, how much energy with the 980 nanometer gets to the peroneal nerve? And it's not very far because it's a rat. And they found that 2.45% of the energy going from the skin made it to the nerve. So we know there's a lot of attenuation with the 980, and that's okay. There's times that heat, was what happens with attenuation, can be a really good thing. So then they looked at how much power should we use. And they said that 4 watts inhibited nerve growth. Don't want to do that. 2 watts actually significantly enhanced nerve growth. And then they said, let's refine it even further. What's the absolute best? And their absolute best was at 1.5 watts and a total of 65 joules for this nerve regeneration. And not only did the nerves regenerate significantly faster, so they got longer, but the rats actually had better reflexes. So it worked with function, not just elongation. Good information. And the last study I have for you is on human patients where they did a coronary bypass surgery through a sternotomy. So they actually cut open the chest, really painful. And they took these patients and they had about a 5.5-inch diameter where they gave about 1,500 joules to the area once a day, and the plan was to do it for 3 days. And they said, okay, if your pain score is above a 5, then you're going to get laser. And the first day, everyone's like, oh, my pain, right? So everybody got laser. By day 2, only 40%, 40 out of the 100 patients needed the laser. And by day 3, nobody had a pain score over 40. Now, if I was the person doing it or the person getting it, I'd say, hey, if my pain score is a 4, I still want the laser because it still hurts. But I wasn't in charge of the study. So a good study helps us know that it significantly decreased pain. Again, look at our dose, 1,500 joules for 5.5-inch diameter area, approximately. All right, overall, what can we take out of this? We can take out that there's more research needed on just 980. There's a lot more of research with 980 and other wavelengths. One dose can help, but multiple doses helps a lot more. 3 times a week for 3 weeks significantly help lower back pain when used with exercises. Not the best wavelength for wounds in iguanas, though they're really hard to treat. And the right dose can significantly help nerve regeneration. That we need to know for all of our patients. And again, in general, we need a large dose with 980 nanometers as compared to some of our other wavelengths. All right, I'm Laurie McCauley with Optimum Pet Vitality. Thanks for joining me with Learn and Go with Laurie. I hope you had fun and I hope you learned something. Take care.